Good afternoon, everyone. Welcome to our concurrent session addressing student mental health and pandemic recovery. So we have two great speakers from the University of Nebraska Medical Center, Dr. Brandy Clarke and Dr. Erika Franta. In addition to being practicing clinicians and assistant professors at the university, they and their team operate the Mid-America Mental Health Technology Transfer Center, which is a SAMHSA-funded regional training center focused on implementation of evidence-based mental health interventions in Iowa, Kansas, Missouri, and Nebraska. They're going to tell you a bit about how to access your own regional center if you're not in one of those four states, so you can make sure you get lots of technical assistance and research. As many of you know, actually all of you probably know, the COVID-19 pandemic has disrupted our lives, everyone from kids to adults. And for some kids, this has actually meant over a year of virtual only education. Students and families have also confronted racial injustice, economic uncertainty, and political turmoil in the past year. That compounded with previous existing challenges like cyberbullying, discipline disparities, lack of access to school-based health supports, culturally sustaining instruction, and inadequate funding, among other things, requires schools to really focus on more than just academic content delivery. It means ministering to the overall wellness of students, meeting them and seeing them as a whole child who needs supports in social, emotional, academic, behavioral health. So now I'll turn it over to Brandy and Erika, who will provide some context around school mental health in particular and recommendations for state action to support students as we recover from the pandemic and return to in-person learning. Brandy and Erika, take it away.
Thank you for that introduction, Megan. I'm excited. I recognize a few names and faces here. Randy, I'm also a graduate of the University of Utah, so nice to see you here as well. I'm going to go ahead and adjust a few things here on my screen. We're excited to be able to come and talk with you about this topic today. It's one that has got a lot of traction and momentum in the last few years, and I think is a really important pressing topic for us to be thinking about, especially as we move through pandemic recovery. What does it mean to be addressing student mental health in a comprehensive way? And how do we do that with the lessons that we've learned in this past year? So as Megan mentioned, I am our project director of the Mid-America MHTTC, and I'm going to explain a little bit more about what my role is and what I do. And Dr. Franta is our school mental health program director. Both of us are academicians, researchers, but also we're providers as well. So we not only train on this work, do research on this work, but we do this work. And so are excited to have some dynamic conversations with you all today about it. So as we look here into who we are and what we represent here at the MHTTC, we wanted to make you aware of this resource that is available to you all. So we are a part of the Mental Health Technology Transfer Center Network, which is a network of 10 regional training centers, and we'll show you a map here of that in a moment, with 2 national centers and a coordinating office. But our role within the network is to help accelerate the adoption and implementation of mental health related evidence-based practices across the nation. That's a really, really big task and includes a lot of efforts, but one of our primary areas of effort across our network is in this area of school mental health. And within that, we help to develop and disseminate resources on what are evidence-based practices and providing tools and resources to the states within our regions. We also provide free local and regional training and technical assistance. So things like today's webinar would represent some of the training that we do, but we also do a lot of intensive consultation on how to implement such practices that we train on. And another part of our focus is just heightening awareness and increasing knowledge of what are the things that are needed within our mental health workforce to help enhance the quality and implementation of our best practices. So in this map here, what you see is our regional national network. We are the 4 states right there in the yellow, which we lovingly call the center of the universe here, because we're smack dab in the center. But if you look across our map here and identify where your regional center might be located, there's one Like we said, 1 center per region, and then 2 national centers. We have the National Hispanic and Latino MHTTC, located out of Puerto Rico, and then our National American Indian and Alaskan Native MHTTC is located out of the University of Iowa. Our coordinating office is located out of Stanford University. So again, as you listed where you're from there, please take a look at this map and find where your MHTTC is located. A brief just disclaimer about the work that we do. Everything that all the information that we provide is prepared through that network under a cooperative agreement funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. This information is freely available for you to use, and you can read the disclaimer here on how to do so and how to cite the content. It's important to know that all of the opinions that are expressed in our presentation today belong to us. They're not those of our funder. So school mental health, as Megan mentioned, this has been it's been a unique year. Lots of opportunity to reflect on the impacts that we've experienced in this year and what that's meant and what kind of an impact it's had on not just the mental health of our students, but our communities at large. But this isn't a new topic. A lot of the things related to student mental health are things that we've been talking about for quite some time. It's just that it's elevated to another level within this last year. So I want you to picture, really quickly, that group of students that we just saw are your incoming group of kindergartners getting ready to come to school. We're going to say next fall, and they don't have masks on here, so we're hoping for the best. But this is your incoming group of kindergartners next year. So as you think about this group getting ready to embark on their school journey, I have a question for you to think about. We move to our next slide here. So thinking about that group as they develop and go through their educational career, what would be the one skill that you would wish for all of them to graduate with? What skill would they possess by the time they graduate? And go ahead and we'll use our chat feature here. So watching first, I see resiliency and grit, empathy,
and I know this is a talkative group, so I'll prompt them. Go ahead and start plugging your thoughts in there.
I like that. We see some more grit. We'll give people time. Sometimes it takes a moment to figure it out and think through it. How to work well with others. The ability to be a successful adult, autonomy and collaboration. I like that, both autonomy and collaboration. Nice. Any other thoughts there? Confidence. I like that. So it's ironic, I have this list next to me of what are typically said, and I could check the box of what most of you have just listed: resiliency, empathy, grit, adaptability, autonomy, collaboration, confidence. There's a lot of those skills, the ability to adjust to life. Ironically, I didn't see anybody list, calculus skills or microbiology skills or chemistry. And that's not to say that we don't think that academics or strong reading skills, any of these things are not important, but we recognize that for our graduating students to be successful, it takes more than just academic knowledge, academic skills. And that our social emotional learning and our resilience, our ability to cope, our ability to interact well with others has a lot to do with how successful we are upon graduation, how well we will do when we're done with school. And so that mental health promotion is a big part of the work that we think about it, and you can move forward, Erika, and in terms of the kinds of skills that we hope to develop in our students. But where and how we place mental health in terms of that skill promotion is sometimes a tricky conversation, and we've had this conversation with many of our schools and districts, is where does this fit? and how do we approach school mental health. And we often talk about using a whole child approach. When we think about how do you support the mental health or well-being of students, think about it from this mindset of supporting the optimal function across all domains. You really can't separate one's mental health from all other things. They really do strongly influence each other. The way one engages in their academic learning, manages frustration, manages attention, manages focus. All of these things impact then how well one does within their academics, how they manage and navigate social relationships. They're really difficult to tease those things apart and separate them into different camps. So we think about them from really this whole child approach and how one's mental health, mind, body, and spirit really all work together. We also, when we're talking about mental health, we recognize that it really is influenced by this combination of our genetics and our environment, that the two really do go hand in hand. And what students bring to the table and what the environment then helps to shape are really also inseparable. And with that, we take the approach then that what we can do within this realm of addressing mental health is to focus on the skills that we can build, coping skills and self-regulation of our mental well-being and our behavior. But all of this also happens within the context of our broader environment, that we really don't exist within a vacuum. And this year more than ever, I think we've been, again, that conversation has been elevated to the forefront, that our socio-political context influences all other things that we do, and it cannot be ignored when we're talking about how we address mental health, how we address the well-being of our students, that we have to look at those environmental and contextual pieces as well. So that as Megan started our presentation today, we talked about recovery from a pandemic and how are we thinking about mental health and how we're going to address it in this year. It really helps for us to take stock of, well, what makes this year unique in comparison to any other given year? What would a typical school year look like? Because again, this isn't a new topic, it's not a new issue. In any given year prior to COVID, we would have expected that 21% of students would have a mental health concern. So maybe 1 out of 5 students in any classroom that we might see might experience a mental health concern in a given year. We also see that teachers year after year reporting that behavior problems within their classrooms are a major concern. Out of a national survey that was collected in 2012, 87% of teachers reported having behavioral problems in their classroom, and at such a level that it was impacting their job satisfaction. Again, not a new issue in the classroom. But some of the things that we were seeing prior to COVID that were also a little bit concerning are these rates of depression, those that are actually meeting levels of diagnosis and higher levels of concern, that rates of depression among teens have been increasing at rates of 47 to 60%. That doesn't mean 47 to 60% of students are depressed. It means that those rates have increased at that pace. We are also unfortunately seeing that rates of suicide are doubling, and that those are some alarming statistics. And we're still at a place of trying to understand prior to COVID why that was. What changes are we seeing that are leading to these increases? And then, as Megan mentioned, we experienced a worldwide pandemic. And that's changed a few things. It's brought in some contextual things to our environment that have really had an impact on our overall well-being. Changes in our routine. We've lost some of the structure that we've become accustomed to and the ways that we really are used to engaging in academics in our schools. We had a lot of unknowns and a lot of loss of control in this last year, waiting for what period, and I'll be honest, I still don't know what phase are we in as we are watching the news and thinking about recovery. We continue to just waiting to see where those numbers go and what they mean for us. Many of our communities and our households have experienced unprecedented financial concerns, loss of employment or underemployment, and that created many financial issues, not just within our households, but communities at large. But within that too, with their social restrictions and safety protocols, some of the things that have been impacts related to that, we've also seen that we've had a lack of access to some of the networks we would usually engage in when we experience some stress. We tend to turn to friends, we tend to turn to family, but some of the impacts of COVID has been that we've lacked access to some of those things that we would normally turn to. Our engagement with our friends, our family, our social activities, we've lost access to those. And in the most unfortunate cases, we're also seeing that we're experiencing higher levels of collective grief. For those who've unfortunately experienced loss within their family, but also just the loss of some of these other experiences. So what has that done to our collective mental health and well-being? Well, we're seeing that we definitely have an increased impact on our children's mental health in terms of increased anxiety, increases in depression. We're also seeing learning difficulties across the board, more behavioral issues acting out. And as children are learning to figure out how do they cope with these things that they have no control over, especially as it extends over longer periods of time. In one of the national surveys that was collected, we saw numbers as high as 1 in 4 students are now reporting increases in loss of sleep due to worry, feeling unhappy and depressed, feeling constantly under strain, and losing a sense of confidence, those skills that we talked about early on. We're also seeing that more and more children are reporting they are now worried about finances and the health of their family, things that they used to typically not worry so much about. But it's not just our children who are experiencing these impacts. We're also seeing in reports on parenting stress that across the board, parents more than other adults are experiencing higher levels of stress as a relationship to COVID. And a large part of that has been distance learning and the stress that's put on their relationships at home, their ability to manage, their ability to work. And so this relationship now with school and parenting has become a source of strain. There's also significant sources of stress for parents as they're trying to meet basic needs, address healthcare issues, and just missing out on some of these major milestones that they've experienced with their children. I can put myself into that bucket as well. My daughter and I both got to experience 2 birthdays while being distanced. And her most recent birthday was her 13th birthday. And so trying to figure out how do we celebrate that while also remaining safe and distanced has been a challenge. But more importantly, what we're also seeing is that COVID is not impacting everybody in all of our communities in the same way. And our communities of color, our students of color, they are experiencing significantly more stress related to COVID. And we've seen that play out with some of the health issues that are being experienced within those communities. And the reason why this matters is as we talked about before, adults have a lot of control over the environment that kids experience. So within the home, or if our adults are stressed, we're seeing that that's not just within the household, but we're also seeing our adults within our school setting experiencing more stress. Teacher burnout has been an issue and a topic that we've talked about for many, many years. It's not new. But what we're seeing is the compounded impact of COVID has really added far more stress to for our educators and administrators than they've ever experienced before. And again, when our educators are stressed, that stress impacts their ability to teach, it impacts their well-being, and it impacts student well-being within the classroom, that environmental impact. Ooh, I feel like I'm a voice of a lot of doom and gloom here, but I promise I am going to get to some topics of more hope. So as we look at these compounding issues related to student mental health and the impacts of COVID, the one other issue that I think is important for us to keep keep in the back of our mind is the issues that we have around workforce shortages. And the Health Resources and Services Administration map here helps to illustrate this in terms of where our mental health professional shortage areas exist. So in those areas that are gray, those would be the areas that we see where there is a higher ratio of mental health providers who would be considered accessible to their population. If you look across our states and territories, we have a lot more blue areas than we do gray. That meaning that we have a lot of areas where we have a lack of access to mental health professionals within our communities. So what can we do with this information? We've seen this increase in impact. We've seen the shortage in our workforce. Here's where we have some sense of some hope here. We do know that when school mental health services are provided in the school setting, that 70 to 80% of students who would receive those services get them from schools. They're more accessible to them there. When they do, they're also 6 times more likely to complete treatment. It becomes part of their routine. They're able to access it in a way that is more feasible. We also see that students who do receive those supports improve their academic performance by as many as 11 percentile points. So again, when we go back to that whole child approach, why does our school mental health matter? Because it improves our academic performance, the standards by which our schools are held to. When we improve well-being, we improve all of those areas. We also see another topic that's on the minds of a lot of our schools and administrators is school safety. When we integrate social emotional learning programs into our school buildings, we improve school safety and decrease bullying, other concepts that we know that many of us are really concerned about. But when we're talking about what school mental health systems are, it's important to think about what that means. And from a comprehensive perspective, how would we define what school mental health looks like? First and foremost, it would be providing a full array of supports and services. And we're going to talk a moment, I'm sure, show you a graphic here that you're very familiar with when we talk about our tiered levels of supports. But things that also not just look at how do we reduce illness, but also how do we promote well-being. These would also be services that are built on a strong foundation of your district and school professionals, as well as those partnerships within the community professionals, your families, and your students. And the last thing when we're talking about systems is thinking again, not only the supports offered to individual students, but how are we impacting the social and environmental factors that impact health and well-being, that context that we referenced earlier on. As I mentioned, I'm assuming this is not a new graphic for most of you here. You're familiar with talking and thinking about things in terms of tiered supports as a way of thinking, not only are in terms of thinking about services, but how we manage resources within our schools. And that this has been a useful way of talking and thinking about things historically. As we think about the recovery in the pandemic, however, we have a few new concepts to kind of think about in terms of how does COVID, impact the way that we think about our resources and impact the way then that we think about these tiers, when in fact we've had more members of our community that have experienced these negative events. Do we now need to increase our preventative or universal supports and resources because our community at large was impacted? Do we also need to think about connecting with more tier 3 supports because we're seeing an increase in some of those diagnosable or mental health concerns, as we mentioned before? But the other thing that I think deserves more of our attention is how we are thinking about where some of our barriers, including structural racism and implicit bias, are getting in the way of equitable services. I think historically we tended to think about equity in terms of access, but really we need to start thinking more about outcomes. Not just are we creating the opportunity for support, but are we seeing equity in the outcomes that students are experiencing? and what barriers do we need to take into account in our context for which we're providing support. As we think about addressing student mental health in the context of COVID, a few things to be thinking about, key points to take away. One is to be thinking about infrastructure support, not just programs and strategies that we can use, but do we have the infrastructure in place really to be able to make them sustainable and to maintain them over time? And one of those is thinking about how we can do more universal screening. Again, as we mentioned, that more concerns were on the rise, how are we identifying those? Again, coming back to our multi-tiered supports, but rethinking maybe where we need to place some of those efforts. Developing triage processes for how we're going to identify when needs are acute and when we need to get access to services that are more crisis focused. One of the things that I really want to highlight within this list, there's several listed here, but one thing that's really important and it's bolded here for a reason is to expect variability. COVID is not hitting everybody in the same way. We're not all experiencing it in the same way within our community. So to know that you're within your school and your system, some people are going to have come out of this experience and they're going to be just fine. They've had access to resources, their families had access to resources and supports. They're going to be doing okay, but maybe some others who you might not have expected are not. And so to make sure that we're looking for that variability in the way that we are addressing those needs and providing those supports. So to help with that, we've collected a few of the resources that are available to you through our MHTTC network to help highlight what it is our network does and to showcase a little bit about what we have available for you. So for that, I'm going to turn our conversation over to Dr. Franta, who will walk us through those resources.
Wonderful. Thank you, Dr. Clarke, for that overview. I hope we've really set the stage for why mental health matters. It has always mattered, but especially now more than ever in the context of where we are moving as a society of how we truly do support overall wellness in our children and families and staff. So we wanted to give you just some access to we have a plethora of resources that are freely available through the MHTTC network. I'm going to highlight just a couple of tools, but just a reminder that each of the regional centers are truly here to provide what we provide as centers is training and technical assistance in that implementation of your school mental health system. And so these are just a few of the tools that we might provide training and technical assistance around. All of these are part of our National School Mental Health Collaborative. So they are tools and products that every center has participated in. So we thought these were some really good tools to highlight. Of course, another link to our MHTTC homepage, as well as the link to the MHTTC School Mental Health homepage as well, if you're looking for what work we've been doing in the school mental health realm within our network. When we talk about building that foundation, right, those tiered supports, one thing that we've found super useful is getting everybody on the same page, building all of our mental health language, our literacy, how we talk about mental health and mental wellness, and how we might identify student needs. So something really cool that's coming out here soon, hopefully in the next month or so, is Classroom Wise. It's actually a mental health literacy program targeted toward educators specifically. It is free and it will be available to for anyone to use, developed in partnership between the MHTTC network and the National Center for School Mental Health out of the University of Maryland. We have also our network, when we first started in 2018, 2019, is we, in partnership with the National Center for School Mental Health, developed a curriculum, a school mental health curriculum, really an outline of guidelines, best practices, and quality indicators for building that system of that comprehensive system of school mental health. We are currently in the middle of reviewing those modules, as well as adding in some state and region level examples through panelists. So if you're free, please join us. We just had the screening session today. But as part of that, we also have regional breakouts. So you'll be able to kind of learn nationally what folks are doing, and then actually get in to some of those regional breakouts to learn from one another regionally. We also have developed a number of resources through our network supporting educator well-being. As Dr. Clarke mentioned, we can't only support the students and children, we also need to be supporting the parents around them and the adults around them and the teachers around them. And so this is just a link to our resource page for educator well-being targeted tools. And then to wrap this up, we just finished a series, it's a 2-part series where we really talked about and contextualized some of the issues surrounding equity, particularly surrounding racial violence, and how we are supporting our Black and Brown students in our schools. It was a very powerful 2-part series. Mainly, it wasn't really content per se, but what we did is we brought some experts in this topic around the table, and we had a 2-part panelist. We had 2-part panels. So please feel free. All of those resources, recorded sessions are available on our website as well. And just to show you again, if you are not from our region of Iowa, Kansas, Nebraska, and Missouri, please reach out to the regional center where you are located. I'm also happy if you are interested in getting in contact with your school mental health lead within your region. I'm happy to help make that happen as well. Again, we do a lot of projects collaboratively too, so. And then last but not least, we are a federally funded center. If you have a chance, I know we're gonna jump into questions here, but if you have a chance right now to just click on the link that they're gonna be sharing in the chat for our survey. It's a brief survey, only a few questions about your satisfaction and some demographic items. This is just how we continue to secure our funding as we are, sharing our resources and providing information across the nation. So thank you all so much. I'm going to move into Q&A. I think Megan's going to jump in.